All right, let's talk about health. In just the next few minutes, we're going to get you set up with all the keywords you need to talk about your health confidently. Whether you're just at home, maybe you're traveling, or even talking to a doctor. I mean, we've all been there, haven't we? You're feeling just awful, and someone asks, "Hey, what's wrong?" And you just can't find the words to explain it. It's so frustrating. Well, that's exactly what we're going to fix today.
Okay, so let's start with the basics. We're talking about those really common everyday symptoms, the ones that let you know you're starting to feel a bit under the weather.
A lot of the time, it all kicks off with a cough. You know that sound, that sudden, loud burst of air your body makes when it's trying to clear everything out. It's probably one of the biggest signs that you're starting to come down with something. And what often comes right along with a cough? A sore throat. Now, the thing to remember here is, it's not just any old pain. It's that specific irritation that makes it hard to even swallow. Yeah, that scratchy, nasty feeling you just can't ignore. Next up, you might start feeling really hot. That's what we call having a temperature. It just means your body temperature is higher than it should be. You'll also hear it called a fever. And really, it's a huge sign that your body is in there fighting off some kind of infection.
So, you've got the symptoms, now what? What actually helps? Well, we have medicine. That's kind of the general word for any treatment. And that medicine often comes as tablets or pills. And of course, for something on the outside like a cut, you'd grab a bandage to cover it up.
All right, we've covered the common stuff. Let's get a little more specific, though. How do you actually describe what hurts? Because honestly, picking the right word here is super important if you want to get the right help.
And that brings us to a really key question. Is it a pain or is it an ache? They sound pretty similar, right? But believe me, they describe totally different feelings.
Okay, so here's the breakdown. A pain, think of that as something strong, sharp, and sudden. Like when you get a paper cut, that's a pain. But an ache, that's a dull, continuous feeling that just kind of sticks around. It's exactly why we say headache or stomach ache. That little word ache tells you it's a constant thing.
And just to add one more layer to this, we have the verb to hurt. You say something like, "My back hurts," and that usually means a stronger or more sudden feeling. So think of it this way. You could have a backache all day long, but then you move the wrong way, bam, and feel that sharp jolt. That's when you'd say, "Ouch, that really hurt."
Okay, so we've been talking about everyday stuff so far, but what happens when things get worse? Let's switch gears and look at the words we need when an illness gets serious.
So, when an illness becomes serious, the whole story changes. You're not just someone who's sick at home anymore. Now, you're a patient who's getting professional medical care. And that might mean you need an operation. You might also hear this called surgery. And the special kind of doctor who does that, that's a surgeon.
Let's zoom in even more now. We're going to look at some of the body's most important organs, the real key players, and the serious problems that can affect them.
First up, the heart. Its job is just essential. It's basically the engine of your body, pumping blood and oxygen everywhere to keep the whole system running.
So what happens if the fuel line to that engine gets blocked? Well, that's a heart attack. And the words we use here are really important. It's a sudden and life-threatening event, and it's caused by one specific thing. Blood flow to the heart muscle gets blocked.
All right, next up, the lungs. Their job sounds simple, right? Breathing. But it's so important. They're what bring in all the oxygen your body desperately needs, and they get rid of the waste, the carbon dioxide.
And a very serious disease that's linked to them is lung cancer. This is a really clear example of how something from the outside, like smoking, can do major damage to these super important organs on the inside.
And our last key player for today is the liver. This is a big, hard-working organ. Think of it as your body's main filter. Its whole job is to be constantly cleaning your blood.
Now, a disease that goes right after this filter system is hepatitis. It causes the liver to get inflamed. So now, when you hear that word, you can immediately think, okay, that's a serious problem with the liver.
Wow, okay, so we've covered a ton, right? Everything from a simple cough all the way to some really serious diseases. But let's pull it all together. Let's talk about why knowing these words is so important.
It comes down to this. The right words do more than just describe how you feel. They can literally help you get the right care. Think about it. Saying I have a continuous ache in my stomach is so much more helpful to a doctor than just saying my tummy feels bad. It makes a world of difference.
At the end of the day, communicating clearly isn't just about language. It's a direct line to better health. When you can describe your symptoms with the right words, doctors and nurses can understand what's going on so much better. And that leads to getting the right care faster.
And that pretty much wraps us up. I'll just leave you with this one question to think about. Now that you've got these new words in your toolkit, how are you going to use them? The next time you're not feeling so great, try to think back to this. See how you can use this vocabulary to talk about your health with a lot more clarity and a lot more confidence.